One very important attribute of Lyme disease infection is that without treatment, it will become a chronic, persistent infection in the majority of people. This means if people aren't diagnosed accurately and have misdiagnosis, the majority of people will go on to chronic infection and chronic symptoms. A more complicated aspect of Lyme disease is what occurs in some people even with treatment. Some patients with Lyme disease will continue to experience chronic symptoms and signs of Lyme disease. The best documented episodes of this happening are in patients with Lyme arthritis. The majority of people respond to antibiotic therapy, but clearly a subset of people with Lyme arthritis, even with appropriate antibiotic therapy, go on to develop chronic problems with their knee, chronic pain, chronic knee swelling that doesn't go away even with aggressive antibiotic therapy. Other stages of Lyme disease may also have chronic symptoms after treatment. This can even occur when patients are treated early in Lyme disease with their acute rash and symptoms. And there's many theories about why people develop persistent symptoms even after antibiotic therapy. And this is one of the key parts of the research at the Johns Hopkins Lyme Disease Research Center, is understanding the mechanism of persistent symptoms in both people that have not been treated, but especially in people that have been treated but remain ill. Understanding those persistent symptoms in people that were treated is a huge mission of our research center. We can't understand effective therapy of people with persistent symptoms until we understand the mechanism, what's driving the persistent symptoms. Are the mechanisms related to the bacteria? Are the mechanisms related to the human immune response to the bacteria? Or is it a combination of things that drives these persistent symptoms in the patients we see? Lyme disease is a multi-system infection. It starts in the skin at the site of a tick bite, but it rapidly leaves the skin, enters the bloodstream and the lymphatic system, and spreads to other areas of the body. The Lyme disease bacteria loves certain types of tissues when it spreads. One of the major tissues that the Lyme disease bacteria spreads to are the joints. Another area that the Lyme bacteria likes to go to is the heart. And this is one area that can cause relatively rapid symptoms and sometimes even fatal symptoms. When the bacteria affect the heart's electrical system, it can cause what's called heart block or extreme slowing of the heart rhythm. When this slowing is extreme, it can actually proceed to loss of consciousness and sometimes death. And this Lyme carditis can progress without treatment, and it is a rare but important cause of death in Lyme disease. A favored site that the bacteria goes to is the neurologic system. The Lyme bacteria can cause meningitis in the first month of infection. The Lyme bacteria also can go to nerves, and some of the favored nerves that Lyme disease involves are what are called cranial nerves. People develop what is called Bell's palsy or a droopy face. The majority of nervous system involvement with Lyme disease causes painful nerve dysfunction, and this common nerve dysfunction is a product of the Lyme disease going to the nervous system, where the nerves typically are involved in sensation and pain transmission. The biggest risk factor for persistent symptoms of Lyme disease is failure to make an early and accurate diagnosis and a failure to initiate adequate treatment. And that again emphasizes why it's so important to make the accurate acute diagnosis of Lyme disease to reduce the risk of people having these persistent symptoms. Another risk factor for persistent symptoms in Lyme disease seems to be neurologic involvement. A major area of our research is looking at neurologic involvement in patients with persistent symptoms in Lyme disease. One intriguing discovery we've made is that people's cognitive function in persistent Lyme disease is not normal. Patients often tell us that they have difficulty with memory, with multitasking, and we found that, in fact, that is true on detailed neurocognitive testing. Patients that have persistent symptoms often have decrements in their cognitive testing. A fascinating discovery we're making is a correlation in these cognitive deficits with actual imaging of the brains using sophisticated techniques of functional MRI scanning and white matter scanning in the MRI. These early findings suggest that there may be a connection between the cognitive symptoms patients report and actual changes on brain anatomy using highly sensitive MRI scanning. The immune system is critical in the interaction of the Lyme bacteria with our body. And the immune system is the crucial aspect of how we fight Lyme disease. Not all people's immune systems are the same. And one of the important genetic aspects of Lyme disease probably has to do with genetic variation in our immune system. Some people's immune systems may not be genetically programmed in an ideal way to fight Lyme disease, and other people's immune systems may be stronger in their way that they respond to the Lyme disease bacteria. This variation in genetics and the genetic control of the immune system is likely an important part of understanding why some people recover from Lyme disease and others develop these persistent symptoms even after treatment. Lyme disease can also be complicated by other diseases and infections. People come into Lyme disease with their own unique health history, and certainly people's underlying health history can impact their manifestations and response to treatment in Lyme disease. And Lyme disease can also occur as what's called a co-infection with other tick-borne infections. Unfortunately, the deer ticks that transmit Lyme disease in North America can also carry other tick-borne infections. And importantly, if somebody gets more than one tick-borne infection from a single tick bite, that can create a more severe and complicated infection.